Good morning, Damon.
Good morning. How are you?
I'm doing well. How about yourself?
Doing pretty good.
Great. So Leah, Dr. Schaefer's joining right now as an attendee. So I don't know, do you have, I'm assuming you've got some sort of viewing access to see who's joining and then, oh, there she is.
Yep.
There we go.
Sorry about that. I don't know what happened.
So that worked. Let me just, I'll let Abbas know to click the join as attendee button.
Sorry, I had to put my phone away so that it doesn't distract me.
Yeah, the phone keeps ringing nonstop, Leah, with more.
Yeah, I put my phone and my watch, like my Apple Watch, in my room and just like put it away.
Yep, got to do it.
Once I said Abbas Khan, once they join, I will upgrade them into a host. I'm just waiting to see their name appear. You guys are good to go now, right? In terms of everyone who needs to be a panelist or a host. Got it. And then last question, who's going to be sharing their screen today?
That'll be Abbas.
Okay, perfect.
And Damon, once we wrap up the presentation portion, will it be you directing traffic as it relates to the Q&A?
Yep.
Okay.
Yep. And right when it hits 10, I'll do an intro and kind of explain the flow.
Great.
All right. Well, good morning to everyone. Good morning. We are excited today to be joining you all with one of our new vendors. And so thank you all for being here today. Our new vendor is Bloom Health. We're excited to have you guys on board to help support private and public K through 12 schools across the state of Texas to support their school communities with COVID mitigation so that staff and students feel safe. So that's a very big deal for us. And so we thank you. And so on behalf of TEA and the Texas Department of State Health Services, we welcome you. How today will flow is in just a second, I'll turn it over to Bloom Health. They'll do a presentation, and then at the end, we will have time for Q&A to answer questions. If by chance we don't get to every question, we will follow up via email. And so if you could put your questions, I know there's a chat feature, but if you could put your questions in the Q&A feature, because then we can pull them down in Excel later. But thank you all. And as you have questions throughout the presentation, you can also put them in the chat or the Q&A. Dishes, my colleagues at Dishes are also on the line. So TAA and Dishes are here to help facilitate this webinar. So with that, I am turning it over now to Bloom Health. You guys can take it away.
Thank you. Hi all, my name is Abbas Khan. I'm one of the founders at Bloom Health Partners. I'm calling in here from a chilly Texas morning here from Houston, Texas. And if I may, I'm just going to present our presentation here. So you should all be able to see our presentation. And I'd like to start with just a quick 30-second video which just shows a little bit about our company and some of the activity that we've been up to specifically in COVID.
Mr. Khan, we can't see your screen just yet. Mr. Khan, if you could, we can't see your screen just yet.
I'm sorry, you can't see our screen, my screen? I'm sorry, one second. Can you see it now? Is that better?
It's coming through now.
Okay, sorry about that.
No problem, no problem. There we go. We're good to go now.
Great. So thank you all again. As mentioned, my name is Abbas Khan. I am joined here today with my fellow co-founder, Cole Lysott, and our scientific director, Dr. Leah Schaefer. Our agenda today is for you to meet our team, help guide you through our Bloom Shield testing program, which is specifically designed for the schools that we support throughout the country, how we get started in that program, and the support that we provide. So just as mentioned very quickly in the video, although we're here talking about schools, we actually support a number of categories. Schools, of course, and we'll get a little bit more specific about this, but we're actually one of 2 vendors that support the entire state of Alabama. We also work with other states and many different school settings, multinational, both on the private schools and public schools, but also many Fortune 500 companies. You probably recognize some of the companies on this list, but you can actually find us supporting employees at all of the Six Flags parks in North America. I think there's 22 parks in North America where Bloom has presence, and also film and TV productions. As mentioned, we are based out of Texas, while we have laboratories in Alabama, Atlanta, New York, Texas, California, and actually other locations as well. We support a lot in our home state. If you're familiar with, there's a popular show called Yellowstone, and they have a prequel right now that's quite popular in 1883. We're actually doing, that's just a couple examples of productions that we're providing support for. But we're working with their studios and Amazon Studios, Netflix, Viacom. If there's a major production, it's actually quite likely that Bloom actually is involved in keeping that set safe and that production safe. We also do live events and concerts, worked with Live Nation, and we were actually selected to support the VIP testing at the Super Bowl. We also continuously support large conferences such as the NACS conference in Chicago, which is the National Association of Convenience Stores, and many other large sales and conference efforts. So we're proud to say that we're trusted by these companies. We're trusted also in airlines as well. We worked with American Airlines here in Texas, where we were responsible for their critical mass centers. And these are the areas which are crucial to keep their operation going. A lot of this trust is actually due to, while you may not know the name Bloom compared to some of the other names that you've heard, we have a wealth of experience, particularly we're particularly grounded in science. Some of our advisors are here in front of you, as you can see. Dr. Nimisha Kalia is actually the Chief Medical Officer of GE. She's quite vocal and supportive when we're designing customized solutions with organizations and schools such as yourself. We also understand that working in the public sector is different than the private sector. So we have the pleasure of having the Honorable Eric Hargan, who's the former Secretary of U.S. Department of Health, who's on our board. We are also joined here by Andrew McCann, who's our Chief Technical Officer, but we have support from Jessica Federer, who's a former Chief Digital Officer of Bayer. We understand that reporting the technology side of this can be cumbersome, and it's sometimes a point of frustration. As we'll get more into the program, we'll help you understand that this is a point of emphasis for us to make this as seamless and as painless as possible. From an academic side, we have Dr. Stemmer, Dr. Shepard, and Mr. Joe Kurland, who respectively are very well-respected scientists, come from strong institutions and very published, so that we are constantly up to date on the science, and more importantly, what it means to our customers and our clients. Speaking of which, why we're here today, as we know, this is well, it's not a favorable time. It's COVID is at an all-time high, and the vaccination rates they could be better. Quite frankly, this is actually, as we understand, this is very much a community health initiative, and we actually have worked with these organizations. As you saw, the board that we have, the panel of scientific experts, what we do is actually provide thought leadership in this space as well. We would look forward to doing the same with you. We understand that this is a community ailment. This is not just specific to the schools, and we can provide a full landscape at Bloom. It's part of our origin to support you in all facets of support. Without further ado, and I'd like to turn it over to my co-founder, who can help you understand that a little bit better.
Thanks, Abbas. And actually, just looking at that chart on the previous slide, the very beginning of COVID, that first little blip, back in the summer of 2020, we were actually one of the first companies in Texas to organize and operate drive-through testing sites. We started right there across from NRG Stadium in Houston. During the peak of that summer, our team was collecting up to 1,000 samples per day, which I think is a testament to our on-ground logistics and operational know-how. Not to mention, it's not an easy feat setting up an operation like that on less than 1 week's notice to get up and running. That said, a similar drive-through program could make sense for some larger campuses, and we'd be happy to discuss that in more detail. Abbas, if you could flip to the next second slide there. So as as Abbas alluded to earlier, the Bloom Shield program is one of 2 vendors selected for the entire state of Alabama in their K through 12 testing program. We've been working with UAB since September of this year on their program and have been operating since October. We have close to 100 nurses on the ground in Alabama, covering almost 3/4 of the state, and over 100 schools with weekly on-site PCR screening testing. Quite simply, we understand the needs of schools and school nurses. As our CEO, Andrew Morton, you'll see his quote down here in the bottom right. The mission of our Bloom Shield program is to support schools' nursing staff in a way that minimizes their burdens and helps keep students and staff healthy and in the classroom. And I think just in the last week, since our vendor information was published on the website, we've received a number of calls already, and I think we've stepped up to the challenge here. We make ordering easy, whether online, email, or over the phone, with fast turnaround times. We also understand that every campus has different needs. We provide antigen or lab-based PCR kits, priority overnight mailing labels, and can even provide Bloom staffing to help support your school nurses. We also provide training materials as needed and weekly office hours with our Director of Science and Operations staff. So the Bloom Shield testing options. By now, most of you are familiar with the different types of tests available, but Dr. Schaefer will get into a few more details on the science after this. But just from a high-level perspective, rapid antigen tests. We do have, the Abbott BinaxNOW rapid antigen tests in stock, and we continue to receive shipments from Abbott every 2 weeks. We also have QuickVue, Quidel QuickVue, and Indicaid rapid antigen tests, and we can ship these directly to the district or individual schools, or we could even send our staff on site with these tests and have Bloom staff provide the specimen collection. Pooled testing, Dr. Schaefer will get into some more of that detail on the next slide. We can provide either overnight mailing labels or Bloom staff can be sent on site for collection. The turnaround time on those pooled tests is less than 48 hours. And individual RT-PCR test kits, again, include overnight priority mailing labels both ways, or we could send Bloom staff on site for specimen collection, and that also has less than 48-hour turnaround time. So with that, I'll kick it over to our Director of Science, Dr. Leah Schaefer, to get into some more of the details and operations of the program.
Hi, everyone. Thank you so much for joining us. I have seen in the chat that there's already some people that I've been in communication with. So thank you guys so much for supporting us. And we're really happy to kind of continue that relationship and work together. As Cole mentioned, we really build a tailored approach to meet the school's needs. And the reason that we do that is that you really need multiple types of tests to be able to detect the virus throughout the stages of the infection. We offer a pooled PCR solution and individual PCR solutions that can essentially detect the SARS-CoV-2 virus at the point of infection. But we also offer a variety of antigen tests that are most accurate during the symptomatic period of the infection. And at that point in time, the antigen tests are actually very comparable to PCR tests. So by having the two together, we're kind of able to offer a sort of hand-in-hand approach to make sure that we're able to detect the virus quickly and effectively. So we offer a lab-based pooled type of pooled PCR test. I'm not sure, how familiar you are with that. So I'd like to get into a little bit of detail surrounding the lab-based pooling option. A lot of, you see a lot about pod pooling, which is essentially where multiple swabs are collected from patients and then they're added to a single tube. So we have chosen not to perform pod pooling because even though the cost is a little bit less and it is still a very accurate technique, In order to identify which of those students is positive, we have to perform a second collection to identify which of the 5 is actually the one with the infection. Whereas with lab-based pooling, we collect each of the 5 samples separately, and then we combine them in the laboratory. And that means that we have the individual tests already on hand. So when we go to deconvolute and perform the reflex test to identify which of the samples is positive, we already have the samples on hand. And that makes it a lot faster to identify which student is actually the one that's infectious. So in addition to that type of testing, we also offer individual PCR tests. Sometimes that's more effective if you have a low volume of testing or you have a very high infection rate. You might opt to, instead of doing the pooled testing followed by individual testing, you're also able to order individual PCR tests by themselves. And that allows you a lot more freedom to kind of identify positive cases immediately. So in addition to that, we offer a lot of antigen test options. We offer the Abbott BinaxNOW, which a lot of you are already familiar with because of the previous program that was in Texas. That is a very user-friendly solution. And, you know, we actually also favor it for most event testing because it has the highest throughput and it's the easiest to deploy online. I would say that, you know, we also offer the Quidel QuickView. The Quidel QuickView is also a highly accurate antigen test. It has a counterpart similar to the Abbott BinaxNOW that is approved for over-the-counter use. And over-the-counter is not actually part of the program in Texas. However, it speaks a little bit to how easy the test is to run. And if the test is very easy to run and it's very easy to deploy, then that means that it's going to be easier for you to scale it up very quickly and learn a little bit more about it on site. And the antigen test, similar to the PCR test, can be deployed in multiple ways. You know, we can either train and support school staff and school nurses to help them deploy it themselves so that they are empowered to kind of take control of their testing solutions. Or if you would like a little bit more assistance, we can also deploy nursing staff to come on site and help support with collection. And that can be quickly and easily deployed. So as we've kind of mentioned a little bit, we offer customized solutions, but we also offer a significant amount of support. I know that some of you have already been in communication with us, so you've already kind of gotten a little bit of a taste of our response time, but you know, you can offer kind of as much initial training and you can offer whatever you can up front, but the reality is, you know, it's very important to guide people through the entire process. And we've worked with enough corporations and with enough schools that we realize that this is very critical and this is very important. So we essentially will help build a tailored approach to what your school's needs are with multiple different testing options, PCR, antigen testing, and multiple types of collection that we can offer you on site, including entryway type collection, or we can centralize into a common area for easy collection. And then we also offer 24-hour support, and we offer a lot of online training options so that you can kind of work at your pace, and so that nurses again are empowered to take control of their testing. Which we've seen to be like very popular because, you know, people don't always want to wait and they don't always have the opportunity for somebody to get back to them. So you have to be empowered and you have to have the resources available to be able to support yourself as well. And so with that, we also offer online ordering options. Most of the initial onboarding is performed just via direct communication. So, you know, through email or phone call or something to that effect. But we can also provide you with ordering forms where you can just place your order online. So ordering should be done once a month to meet that month's testing supply needs. And so every order is essentially vetted, and then we make contact with you after the fact, but it does put the solution sort of into your hands. So you don't necessarily need to wait for somebody to get back to you. You're always able to kind of move forward at your place and get back to learning, which is what this is all about. So here's a little bit of a guide to what the onboarding process looks like. You know, as I mentioned, some of you have already started with us, and so you're kind of at the early sign-up stages, but a lot of you have already received test supplies, even though you're sort of at the early sign-up period, because it's just very important to us that we minimize the disruptions to you and to your school. And so we really prioritize getting you the supplies that you need. So essentially, there's about a 3 to 5 day period, which many of you are in the process of, where you'll essentially do your initial onboarding. We'll send you training materials, consent forms, anything that you need to help support your school staff. And then we'll essentially go through a setup period. Now, the setup period, if you elect to do a self-administered test, might be essentially non-existent. But if you decide to have Bloom help assist you, or you change your mind in the future, or you have a surge of students who want to get tested and you need additional support, it only takes us a day or two to get you guys set up and get everything together for on-site collection. The registration process, which sort of happens in concurrently with the other steps, is essentially where we onboard you into our Bloom Shield web portal, where you're able to manage your test results easily and efficiently for both your antigen and PCR tests. You're able to, in fact, manage not just your testing, all of the test results, but you're also able to manage your participant list and your consent forms. Once the setup process is sort of complete, then you can go through a little bit more, the sample collection process will sort of take place. And then the sample tests can be added to a prepaid shipping label. Again, this is for PCR tests. This isn't for antigen tests, which are performed on site and results are received on site. And many of you are already familiar with that. But for PCR tests, whether they're pooled or individual PCR tests, essentially you'll receive a kit with a prepaid shipping label. The sample can be collected. It'll be added back to the box with very easy instructions, and then it can be mailed back to the lab for processing within 24 to 48 hours. And, as I mentioned earlier, we don't have the need to do a second collection if we find that one of the samples is positive. And then typically, once we've received the samples, you will receive your results within 1 day or 24 to 48 hours, and those will appear automatically in your web portal. But you're always free to reach out to us, to our help and our support line.
Great.
Leah,
So I'm sorry, cutting you off here. Is there something you wanted to say here specifically?
No, I was just going to say that you're able to sign up and onboard quickly and effectively through multiple options. You can either use email, which some of you have already done. You can sign up on the phone. We have a very responsive customer service staff that will get you into our system. And then part of your onboarding package will include training materials, your sample collection information, and then your program information.
Excellent. Thank you. Thank you, Dr. Schaefer. I'll actually just close and we'll open it up here for questions, but just a few thoughts that we shared. And I just wanted to reiterate on a few facts. Number one is that you folks will find that we are proven in this. As Cole mentioned, we started doing this at the onset of COVID and have, I'd like to go as far as to say we've seen it all. And quite honestly, we've taken those tough projects. Some of the areas that we work in aren't desirable. Some of the challenges that we've been faced with by many different categories, not only schools. It's actually, our tagline is that we find unstoppable as possible. And really that is the goal of our company, is to keep your organization. Let's be honest, nobody wants to deal with this. It's not a very fun conversation to have. It's causing a lot of stress. You, as many other operations, run on very lean schedules. You have tight budgets, and this is just creating a burden and stress on yourselves. We acknowledge that fully. I want you to know, as mentioned earlier, that we do provide a lot of thought leadership in this space. Even if you choose not to work with us, I encourage you all, every 2 weeks, we actually have our stakeholders, specific customers, and scientific experts who come on a webinar. If you can find us on LinkedIn, We just had the chief medical officer of GE speak through some of her organizational challenges. I'm actually looking forward to having the executive producer of Ozark, Patrick Markey, who's going to also be speaking with us. Just a different perspective on another industry. It's amazing how we can learn from each other, different categories of businesses. And then I know we know this space well, and I can assure you that you will not receive better customer service than what we provide. As Leah mentioned, her staff is going to be open for a Zoom call from 10 to 12 o'clock. And actually, we understand the reality of the situation is that people call when they want to call, and we provide that support. I just wanted to, just if there's one thing that I can convey to you through this is that we try to make this as easy as possible. We have references. If there's folks you'd like to speak with, specifically in your category or other areas of business, I assure you they've all been thrilled with our service, and we're very proud of that. So thank you very much, and I'll open up for questions now.
Got it. So for all the attendees, see some things coming through the chat. Let me look at the Q&A, and then for our presenters, you all also have access to the chat and to the Q&A, but I can read as well.
Great.
Angelica Saldana says, can I do PCR test to the students in the school where I work, even if I am not a licensed nurse?
So all of the, I don't know if you guys can hear me. Okay, I came off mute again. So, the actual PCR testing is a lab-based test. And so you won't be performing the actual test itself. You would just be performing the collection portion, which is the same throughout the antigen test and the PCR test. And it's actually approved for self-administration. So you can conduct the PCR test, but you would essentially put the PCR samples into one of our pre-packaged boxes, and then with a prepaid label, return it to the lab where we would process the test.
Got it. Thank you. Our school does not currently have a CLIA waiver. Do you assist in obtaining one?
Yes, we can assist in obtaining a CLIA waiver if
Okay.
necessary. Yeah.
All right. Please continue to send in your questions. And then Leah, if you can see in the chat, I know you answered one already. You answered the buy next now available to order, correct?
Yes,
we do.
we do have buy next nows that are available to order. I think Cole answered that, but yeah.
Yep.
And then I sort of half answered one because we had to start again.
And then another one says, will you honor testing consent forms we have already received from parents at the beginning of the school year and have saved within our student data management system?
Yeah, so I've actually answered a few questions about this so far. And essentially, we do, just for minimal disruption, try to honor previous consent as long as that consent has not expired. A lot of the consent forms only have a 1 year a sort of lifespan as part of the agreement. But it essentially depends on the consent form and the test that you want to perform. A lot of the consent forms that were previously available were specific to like the buy next now or a specific other vendor. And in that case, we can't honor them. We have to have a broader description of what the testing options are going to be included in the consent, right? So if it specifically says buy next now, and we're performing testing using the Quidel QuickVue, or we're using testing for, or like we're doing PCR testing, then that essentially wouldn't be covered in the consent form. We would have to do a new consent form at that time. But we, when we perform sample collection on site, we do have to verify that every student has consented. Now, when the Bloom staff is not the one performing sample collection, and it's being performed by the nurse through the sort of self-administration process, then they are responsible for obtaining those consents, and we can provide them with a template consent form that they can use, but they would be essentially responsible for managing that.
Got it. Thank you.
We hear you loud and clear, Tasha Barker. We're happy to provide them to you as well.
Okay. Let me go back to the Q&A. I think we have some more questions. How does the reporting system work? I know you all covered it, but if you can cover it again in terms of when folks get test results from the PCR antigen test, what do they do from there?
So essentially, when they're onboarded, we will provide them with a special access, right? And kind of to speak again to the consent forms, we have to have for this process, for the PCR testing process, and for the test results to be viewable by the nurse, there needs to be two consents. There needs to be the consent for the test to be performed, and there needs to be a HIPAA waiver, which essentially permits them and us to view the test results of the patient or multiple patients. So essentially what will happen is during that process, we will send a link that will allow them to set up, and we will have instructions and support throughout that process. But essentially you'll register to a special link where you'll be able to view all of the test results, and you'll just log into your portal to view the test results. You'll essentially have a tab that will say participants and then batches or orders. And if you open up a batch order, your test results will be there. And, we have guidance specifically on, the different types of tests, what those results mean, and, what kind of your expectations should be when you're viewing those test results. But both antigen and PCR test results can be managed within the same portal.
All right, thank you. I put some more questions in the chat. Do you currently have a large supply of BinaxNOW tests?
I can take that one, Damon. So I guess large supply is a relative term, but I'd say with the demand and calls that we've been receiving, over the last week since our vendor information has been published, we've been trying to make sure that the order size is consistent with kind of the size of the school district for now, and just with all the demand, we're trying to allocate the current supply that we do have on the ground to make sure that everyone has enough BinaxNOWs to get them through the next 2 weeks. One, with the Omicron surge, but secondly, as I mentioned, I think earlier on the webinar, we receive our Avid shipments every 2 weeks. So the next shipment that we receive will come in the next, I think, 10 days. So we do have BinaxNOWs on the ground, and we're trying to fulfill orders that will sustain schools through the next 2 to 3 weeks. So I hope that answers the question.
Okay, thank you. Our next question is, they worked with me. Okay, so someone has a testimony. I can attest to how fast they are. They worked with me over the weekend and my tests were delivered this morning. Very easy, great communication. So that's a testimony to you all. Question, how many PCR tests are the minimum amount to have, you have to collect to send them to the lab?
It's five PCR tests.
Okay. Pretty straightforward there. Okay.
And thank you for the compliment. Really appreciate it.
Yeah. Please continue to drop your questions into the chat. And then I also encourage my colleagues at Dishes, because Dishes and TEA, we get emails daily. And so if you all think of any questions that you would like to come off of mute or place in the chat, feel free, just to ensure that all listeners are benefiting from the session. What's the fastest way to get on board, email or phone?
I would say probably email is the fastest way. We're very responsive via email, but there's certain information that we need to confirm, and we need to make sure that we do have your correct email and there's no typos or anything. And so typically, even if you onboard over the phone, we'll instruct you to sign up by email. And again, that's just to ensure that all of the information is accurate and correct, and there's no misspellings or anything like that that can kind of come out of a phone conversation.
Perfect, thank you. Question for you all. So when it comes to, could you just cover again, if, in terms of consent forms for bilingual parents, specifically Spanish, in terms of communication, because several of our districts or school systems throughout the state, the majority of the community speaks Spanish. And so can you just cover that in terms of bilingual and things being translated?
Yes, all of our consent and training materials are translated both into English and Spanish. And I think we're working on Korean as well, but it's English and Spanish primarily. We have everything in.
Got it. Someone is asking, Ms. Barker is asking, can you all show the online portal process once again? You could just go over that again for the folks.
Yes, I don't know if we have a specific slide where we kind of go over it, but I'm happy to talk you guys through it. Essentially, when you sign up with us, we'll provide you with a dedicated link and sign in that you can use. And when you log in, the test results for your school will be linked to your profile. And when you essentially open up your batch order, the test results will be there, and you can either manually enter in antigen test results, or we will submit the PCR test results directly into the portal. There's we have a specific documentation that kind of describes like what each test results means, whether it's not detected or positive or inconclusive or invalid, or if the test result hasn't come in yet. And essentially, and we can provide you guys with that information to help serve as a guide while you're reviewing your test results. And when before the test results have been submitted or entered, essentially they'll just show up as sort of a dash, like there is no test result there, but you should still be able to see the batch of the samples that were collected while you wait for the test results from the lab.
Perfect, thank
I don't know
you.
if that helps answer your question.
Can we use your staffing for rapid antigen test ordered from you without using your online portal? We are already on board with the TA vendor, but don't really want to change the resulting process.
So we do have to manage I see that there's a hand raised from Diane, so this looks like this is probably a dishes question.
Yeah.
I don't know if you want to take that.
Yeah, go ahead and come off mute, Diane.
Okay, so Damon, can you read the question again?
Yes, ma'am, and I've also dropped it in the chat so people can see it as well. Can we use your staffing for rapid antigen test ordered from you without using your online portal? We already are onboarded with a TA vendor, and I have stuff popping up. Sorry, with a TA vendor, and don't really want to change the resulting process yet.
So the way that I understand it, you would be using Bloom's product and reporting under another vendor, and I don't think that that's good practice because Bloom is responsible to DSHS for reporting, and they have to get that information. So I don't know what other vendor the question is referring to that they're already using.
Yeah, I'm not sure.
So the answer is no.
Got it. Okay.
Thank you.
All right. We begin with Thermo Fisher, but now they cannot continue to supply needed tests. So so Diane, I think that's the follow-up there is, yeah, that's the follow-up there from my interpretation is that
So they're
yeah.
working with Thermo Fisher currently. Thermo Fisher can't give them the test, so they want to get the test from Bloom and report to Thermo Fisher. Yeah, no, that's not good. Because Bloom, again, Bloom has a requirement to DSHS.
Yeah, and if it's our staff on site doing the collection, that's
Right.
another issue as well. But that said, Barbara, thank you for the question. And I would say I know it's it's a pain sometimes to learn a system and then switch to a new one. But I'm very confident that you'll find the onboarding in our portal very if not pretty easy and it's pretty straightforward platform. So if you don't mind sending the K12 txk12@bloomhealthpartners.com an email after this, Dr. Schaefer or one of the members of her team could walk you through the setup process and And Leah, it's probably less than 10 minutes, for, a testing coordinator to get set up on that, and or nurses. Maybe you can expand on that.
Yeah, the setup is very easy, to get a nurse into the system. We do, we've done this, kind of across the country and with also other multiple schools. And, we've dealt with sort of various levels of, technical expertise, from people who are, very, new to kind of computers and having portals like this, to people who are very well versed in technology and things like that. And the process is very simple and easy to do.
Got it. Can you guys see this last question?
Yeah. Is that
Um,
from about manually entering?
Yep, and I'll read it just so they can have it for the recording. If we manually enter, will we have to enter the information for the same person each time, or will the person's data remain in the system for us to only ensure the results? We have to test multiple times due to close contacts.
Yeah, I understand that. I think I understand your question from before a little bit more clearly now. Yeah, essentially once the person's been added into the system, you don't need to add them again and again and again. When you're going to go to perform a collection, you'll essentially click on your collections button, which will bring up a sort of pop-up box, and you can type the person's name in, and provided that you have Wi-Fi access, you should see the person's name appear in a drop-down sort of drop-down box. And if it appears there, then that means that they have consented. And if it doesn't appear there, that means that they have not completed the consent process. So essentially you can just add them directly with that information, and they should be available to you every time that you perform the collection. And then, so essentially the thing that you're manually entering every time, you'll choose whether it's an antigen test or a PCR test. You'll add the sample ID in, the type of nasal collection that's for the test, the shallow nasal sample, which is covered under this program. But those things, the features that essentially change every time you perform a collection are the things that you need to add every single time. So the sample ID associated with the sample, whether it's a PCR or an antigen test, and then to select that it's a nasal swab. And then essentially it'll populate in your collections box, where you would then, once the test is completed, you would manually enter what those test results are. And then for PCR tests, the lab-based test, it essentially, because the test results are coming from the lab, it will essentially restrict you from manually putting the test results in. Those would have to be transferred into your portal by us at the lab. I hope that answers your question.
All right, thank you. We have a question from Marisol Hernandez. It says, how many staff members are allowed to have access to the same account to view results?
This is a good question. So we don't have a limit on how many people can have access. However, each one has to be authenticated, right? Every person who is going to be viewing the test results, they are going to be viewing a student PHI. And so it's highly sensitive. And so we would essentially, with your initial onboarding, we'd speak directly to the testing coordinator, we would speak to the school, but that would have to happen every single time, each person that you add, we would have to authenticate that they are permitted to have that access.
Oh, sorry, I was on mute. Is there a feature that allows us to test visitors and supply them with, so
That might be a dishes question.
yeah, and I can jump in here too. So
Sure.
with the K through 12 COVID-19 testing project that TEA has in conjunction with Dishes, in accordance with grant guidelines, the tests can only be administered on students and staff members of the district, which does include board members. So if they're not a central office staff from the district, a board member, or a staff at the school, then these tests cannot be administered on those individuals. And that's accordance with the grant guidelines. So I've answered that. And then there's another question that I'll take. How does the payment process work for the districts that have a TEA COVID testing allotment? So it works the same as with any other vendor. Districts that opted in have been given an allotment based on a formula over with student and staff population. And then that is posted on our website, the allocated amount. Schools do not directly receive the funds or interact with the funds. Once the school district orders from a vendor, that amount is deducted, that expenditure is deducted from their allotment, and then we update that weekly. And so you never see it, but we have a vendor reconciliation piece, which is why after any school district receives test or testing services, there's the test services and report form that you have to fill out. That helps us reconcile the invoice. You order it, Bloom would send the invoice to Dishes. We reconcile the invoice with the report that you've received it, and then that's taken care of, and that amount is deducted from your allocation. So that's how that process works. It's also listed on our FAQ on the website. And then if you want to follow up via email, we can as well. We got about 14 minutes left, so please continue to drop your questions in. And like I said to my colleagues at Dishes or whomever else, if there are any questions that we haven't gotten to that come up frequently, please feel free to ask. I'm just trying to make a little room. I'll throw this one out there and then hopefully other folks will jump in. So what happens in the event that a school system orders test, and then they arrive and the test package is damaged, therefore the test is damaged, right? And so they can't use the test. What are the logistics around getting that test replaced?
So essentially, the turnaround time for replacing damaged product is, as quick as it is to order. So depending on where you are in Texas, we would either offer a same day or next day replacement on all of that product. We would essentially start processing the order for replacement so that there isn't any delay as soon as we discovered that there was damaged material. And then we would we would essentially send a carrier to collect the damaged product so that it can be kind of disposed of and cataloged.
Got it. We have another question that came in the Q&A feature. I'll drop it also in the chat so you all can see it. I just dropped it in the chat. It says, if a registered nurse required? I think we kind of touched on this earlier. We're a small private school with a part-time volunteer nurse only.
No, there's no nurse requirement for this type of test because it's a shallow nasal. It can be performed by essentially anyone, and the analysis itself is not it's not necessary to have a nurse. They do have to be trained, however, and we do offer very comprehensive training materials, but it doesn't have to be a registered nurse, no.
Okay, thank you. Plume, as we wait for any other questions, if there's any other things that you all want to state or just throw any other information out there that you feel might be relevant to the webinar, you're more than welcome to. We have about 11 minutes left.
I don't really have anything to add. I do want to kind of highlight that we do have open support hours from 10 a.m. to noon every Thursday. Those hours, they might change if we find that they're not convenient for people to reach out and contact us. But this is an opportunity for our customers to have face-to-face interaction with us and get whatever questions answered that they might need. We also offer 24-hour support via email and phone. And we really answer the phone basically all the time, but our specific hours are 8 a.m. to 8 p.m. Just in case somebody needs to sleep or something like that. But you're free to reach out to us by phone, email, or you can show up to our office hours, and we're happy to help you.
Something I'd just add to that, Damon, that, as it relates to the office hours, of course, if someone has, a question, don't hesitate to reach out via phone or email. And in the event that we do need to jump on a quick Zoom session to walk someone through something, we're always able to do that even outside of office hours. We really pride ourselves on the service aspect of this and trying to make things as easy and convenient as possible. And we understand, well, in an ideal world, everything could be automated and hands off. That's just not how the real world works, even in 2022. So, we're very much, available for human support, around the clock, like Dr. Schaefer was alluding to. So don't ever hesitate to reach out. We're happy to jump on Zoom calls if we need to walk someone through something on video outside of office hours. Our team's available.
Perfect. Well, thank you. I think those those office hours, I think are a great feature. So thank you all for having that. I'll give a couple more minutes, and then if we don't get any questions, we'll conclude. Just for everyone on the call, this has been recorded and will be posted at the end of the week, so that anyone who's missed it or wants to go back and review, you'll have this information. And then Bloom is going to provide us with their slide deck that we'll also post, so you could print it out and have that to refer to. I think a question just came in. Are consent forms digital for parents to fill out?
The consent forms come both in digital and paper format. You can provide them with a sign-up link that they can use to consent, or we can provide you with paper forms that can be distributed to parents.
Got it. This is more, I'm gonna let this next question be for dishes. If we buy tests with other money for our pre-K, do we include them in the reporting as we would for K through 12? And it's in the chat as well, the question.
And Shannon, I think Shannon is on. Maybe not.
Sorry, I was having problems getting myself off of mute.
Perfect, thank you.
If you are buying tests with other sources of money, they should not be reported through this grant. Only tests that are purchased through this allocation system should be reported.
Got it. Got it. Thank you for that, Shannon. All right. Well, I want to thank Bloom again, Bloom Health Partners, for being here with us today and for providing such a detailed presentation. Once again, I know we did it up front, but we want to just thank you all sincerely for supporting us in this effort and school systems across the state of Texas with COVID mitigation and testing services to ensure their kids and staff have a safe environment to come to. So thank you all so much. We'll be in touch. Dishes, thank you all for your partnership, and for everyone that has joined us today. We're looking forward to continue to supporting you. Go ahead and start reaching out to Bloom if you're already on that allocation sheet, and let's get those tests to these kids and these staff members. So thank you all. We'll be in touch soon.
Thank you, everybody.
Thank you. Have a good day.
You too. Bye.